Hi there, Lacey. Okay,
Hi.
my name is John. Okay, I'm a licensed professional clinical counselor. Okay, so today I'm going to be asking you some questions just so I can get a better read on how you're doing, who you are, why you came here to therapy. Okay, so we're just going to go down a list of questions. Feel free to ask any questions that you have from me if anything's too confusing or you're not sure on what your answer is. Okay. So the first thing I'd want to ask you is, what made you come to therapy?
Oh,
What
well,
is what is your reason?
um, well, I'm pregnant.
Okay.
I'm expecting,
Okay.
and I'm really excited. And I have doubts that my partner is on board with the whole pregnancy. I mean, we've got the whole house ready for the baby and everything, but
Okay.
he's never home. So I don't know if it's like just me. I just need like a clinician or someone to tell me if I'm going insane or if there's something. Is that what you do? Like if no?
Not exactly. We wouldn't
Maybe I was thinking
necessarily
about
say.
a psychic. Okay. There is a psychic. and a
Possibly,
psychic.
possibly. So, yes, as a therapist, if I were to give you kind of a brief synopsis of what we do, is we're here to help guide you to better understand the issues that you're going through right now, so you can find the answer yourself. Okay. Um, with that being said, thank you for sharing. Okay, now the next question would be, are you currently taking any type of prescription medications?
No,
No
I'm
medications.
pregnant.
Okay, we just want to make sure, okay? It's just a standard question, but I appreciate you disclosing that, okay? With that being said, let's go ahead and move on to the next couple of questions. Do you feel or have you experienced any different types of moods, such as feeling anxious, depressed, agitated, angry, anything like that?
All of the above.
All the above. Okay. And this is all recent?
Well, yeah, I don't know if it's the pregnancy hormones or if I'm really just making something up, but yeah, just.
Okay. I'm gonna ask you a couple more personal questions. I skipped over a couple of things, so forgive me for that, but not a big deal. Okay, so you mentioned you're pregnant. I don't want to make any assumptions, but I would ask, are you currently married? What is your status? Okay, perfect. Have you previously received any type of therapy before in the past?
No, this is my first time.
This is your first time? Okay. You told me you're not taking any prescribed medications, which is good. Okay, if you were to describe your current overall physical health, and I would give you 5 descriptors, it would be 1, which would be poor, 2, unsatisfactory, 3, satisfactory, 4, good, or 5, very good. What would you say you're at currently?
Well, I think given my situation, I think I'm doing okay. So maybe a 4.
Okay, so good, nice. That's good. That's where we want you to be, if not very good, right? Okay, and then obviously this contributes to your health. How do you feel your current sleeping habits are? Are they good and not so good?
Not really. I'm kind of like, this is like, I'm 5 months into my pregnancy.
Okay.
So I'm tossing and turning.
Would you consider them poor, unsatisfactory, or?
Is there a 3?
There's poor, unsatisfactory, satisfactory, good, and very good.
Okay, so.
From the scale that we would want to ask, so.
Unsatisfactory.
Unsatisfactory, okay. Do you feel that's most of the time, or specifically because of the pregnancy?
Probably because of the pregnancy.
Okay.
And probably I'm thinking a lot because my husband's not coming home.
Okay. And do you feel that that's contributing, obviously, that thinking a lot to you not being able to sleep? So it's the pregnancy and you thinking a lot about your husband in general?
That's correct.
Okay. Is there anything else that you feel might be affecting your sleep?
No, those are the main concerns.
Those are the main concerns. Okay. Thank you for sharing. In regards to your physical health, do you exercise generally?
I go for walks.
Okay. How often would you say you go for walks?
Daily.
Daily? Okay. How long are these walks?
20, 30 minutes.
Okay. Do you feel you get a good workout when you go for those long walks?
I don't want to get it too much of a workout because I'm pregnant.
But just enough, right? Or
Yeah,
you
just
still...
enough.
Okay, that's perfect. That sounds like you're doing
Getting
good.
fresh air.
Yeah, get some fresh air, get some body movement going on. I think they still recommend you exercise to a degree, right, while you're pregnant, so
Yeah.
that's good. Excuse me, how many days would you say per week that you go walking?
Daily, so like 7 days.
Oh, you walk every day,
Yeah,
nice,
every
perfect, yeah, keep at it, right?
Okay.
Aside from walking, are there any other exercises that you do?
No, not at the moment.
Okay. Did you used to go to the gym after, or before, should I say? Before you had it? Before, should I say? Again, this is, forgive me for my miswording that.
You're forgiven.
Okay. Have you had any difficulties, obviously you're pregnant, with eating?
Oh, yeah.
Okay. What type of eating problems would you say you're currently experiencing?
Well, right now, no, but like about a month ago, I was still having like morning sickness.
Okay. Okay. And did that make you not want to eat food, or how is it affecting your ability to eat?
Hold down the food.
Okay. Got it. Okay. But aside from that, did you feel you had a healthy appetite?
Right now, I do.
Okay. Are you currently experiencing any type of overwhelming sadness, grief, or depression?
Yes.
Which one?
All of the above.
All of the above. Okay. How long have you been experiencing those?
Maybe
those
not
feelings?
grief, but I'm extremely sad
Okay.
at times.
Okay. Is there something specific causing that you can identify, or you're not sure?
No, I just told you I'm having anxious thoughts because of my husband.
Right.
Yeah.
But is that the sole
Okay.
reason why? That you're feeling sad and depressed?
Yes.
Okay. So those.
Or like I said, it could be my hormones.
It could be. It very much could be. Okay. Again, we want to get a general overview of what you're doing and how you're doing, so we can best identify how to help you. So you mentioned you're experiencing sadness and depression, but not grief, and you're also experiencing anxiety, panic attacks, any type of phobias?
No.
No. Okay.
But I don't like the water, for sure. I don't know if it's a phobia, but I don't like the water.
You don't like pools of water, like the ocean?
Yep.
Okay, pools of water. Too much water in general.
Yeah.
Okay, like bodies of water. Okay. Is there a particular reason why you don't like big bodies of
I'm
water?
having nightmares about lakes and ocean.
Okay.
It's very dark.
Okay. And those dreams are contributing to that, it seems. Okay. Right. And how long has that been occurring, where you've had these dreams about
Just
water?
recently.
Just recently?
Again, it could be because maybe it's my pregnancy, my bladder's full and I have to use the bathroom. It could be that.
Okay.
Yeah.
Okay, thank you for sharing. Are you currently experiencing any type of chronic pain? I would assume so because you're pregnant,
Yes.
but I'm not here to make assumptions.
No,
I'm here to
no,
ask
I'm
you,
glad.
right?
Yeah, I'm glad. No, just my back and lower back and yeah, just
Okay.
nothing nothing outside what I'm supposed to, I guess, be feeling. So.
Okay,
Mhm.
so it's solely, you would say, due to the pregnancy?
Yes.
Okay, and that, does the pain seem to be manageable with like a cold compress or putting some heat on it?
I didn't think about that, but thank you.
Yeah, that
I
might,
can try that.
might work out, right? You can always
Yeah.
ask your doctor what he would
Yep.
recommend. But that's good. If it's just that, you know, obviously pain, we don't want to feel in pain, but if it's
Mhm.
just because of that, you know, then hopefully there's nothing, no cause for concern, it looks like.
Yeah.
Again, this is making an assumption, but I still want to ask, like, do you drink, alcohol more than once a week?
Right.
No, okay, good. And then, again.
Can I have? I can't, right? So.
I'm pretty sure
Yeah.
the general consensus of society is not to. You can feel free to ask your physician,
Mhm.
but, yeah, generally, you know, just to be sure. Again, I don't wanna,
I hear in European countries they do allow.
I would go ask your doctor, alright?
Thanks.
Just to get a more
Mm.
informed medical opinion, so that way, you don't feel like I'm telling you what to do, okay?
Oh, okay.
How often do you engage, if at all,
Mhm.
and again, this is just asking the question,
Okay.
in drug use?
Okay. None.
None.
Yeah.
Okay,
None
good.
at the moment.
Good, okay. And you said you're married,
Mhm.
right? So how long have you been married?
2 years.
2 years.
5.
Okay. How long have you been in the relationship together?
5.
You said 5, right?
Mhm.
5 together, okay. Now, if I were to ask you
Mhm.
to rate your relationship on a scale from 1 being poor to 10 being exceptional,
Mm.
what would you say?
I think I want to say about 5, 6, just because I'm having little doubts. Again, it could just be my hormones. I don't know. Just be my anxious thoughts,
Okay.
the dreams. Mm.
Understandable.
Mhm.
Okay, you have a lot going on.
Mhm.
Aside, obviously, the pregnancy, I feel like is a big contributing factor right now.
Mhm.
Are there any other significant life changes or stressful events aside from what you've already told me, the dreams, the
Mhm.
pregnancy?
No, but I'm about to have one.
Okay, what is
Well,
that
like
exactly?
giving birth. Yeah.
Ah,
Mhm.
okay, because I was
That's
like,
what I'm anticipating.
got it, okay, again, not trying to make any assumptions, right? So, I'd wanna find out because, you know, things happen, right?
Mhm.
And so it's not just always the obvious things.
Mhm.
So, you know, having a child, obviously, I would assume it's gonna be stressful.
Mhm.
Are there any other worries or life changes that you're expecting aside from, you know, the stressful event of having a baby?
No.
No?
Mhm.
Okay. So we're gonna go ahead and move on. Now, these questions specifically are gonna be in regards to your family's history,
Mhm.
okay? So just feel free to say yes or no, or list, the person who you
Mhm.
feel would fall under this category,
Sure.
okay? So, is there anyone in your family who currently has or has had, issues with alcohol or substance abuse?
No.
No, okay. Is there anyone in your family who has or has experienced, anxiety?
No.
No, okay, good. Is there anyone in your family who has currently or has in the past experienced depression?
No.
No. Anyone who has or is currently going through, any type of domestic violence?
No.
Okay. Anyone who has experienced or is currently experiencing eating disorders in any
No.
type of way? No. Okay. Anyone who in your family who's had to deal with obesity?
No.
Anyone in your family who's had to deal with obsessive compulsive behaviors?
No.
Anyone in your family who may have been diagnosed with schizophrenia?
No.
Anyone in your family who may have attempted suicide?
No.
No. Okay, good. Are you currently employed?
Employed?
Mm-hmm.
Yes.
You are currently employed. Okay. Where are you currently employed, or what is your employment situation?
I work at Petco.
Okay, you work at Petco. That's fine. It's a job. Okay.
Yeah, I walk there and I
Oh, it's within walking distance.
Oh yeah.
Perfect.
Yeah. That's how I get my walk.
Nice.
Yeah.
Perfect. Okay. And do you enjoy working at Petco?
Oh yeah.
You do?
Mm-hmm.
Okay. What would you say you enjoy about working at Petco?
I like meeting other people, just keeping myself busy from my anxious thoughts.
Got it. Do you like being around the animals there,
Or people.
or people?
Mm-hmm.
Both?
Mm-hmm.
Okay. Is there anything stressful about working in a place like Petco?
Well, because I do have to walk there sometimes, the stressful part is like I'm at the cashier
Okay.
and I have to use the bathroom
Okay.
like a lot, and sometimes, like if there's a long line, that's a little bit of a stressful situation.
Understandably.
Yeah.
Okay. Do you feel that, again, not making assumptions, you don't always get the support you need? As someone who previously worked retail, I know how it can be sometimes. So do you feel that sometimes contributes to your stress, maybe not getting enough support at work sometimes where you should be?
No, I think most people are very friendly and happy to help.
Okay.
Mm-hmm.
Well, that's good at least.
Yeah.
You know? Yeah, it seems like you have some good coworkers there.
Mm-hmm.
Would you consider yourself a spiritual or religious person?
I think I'm more of a spiritual person.
Okay.
Mm-hmm. I believe in a deity.
Okay. Would you feel comfortable describing what is it that you?
I'm Catholic.
Okay.
Mm-hmm. I just don't go through the whole religious part of it. But.
Got it. Okay. Again, this is just you sharing whatever you feel comfortable with, so don't feel any pressure.
Okay.
Okay. I appreciate you sharing anything with me. Now, I want you to think about this. People have a tendency to overthink these.
Mm-hmm.
When I ask, what do you consider to be some of your strengths?
My strengths. Well, I think I'm pretty positive for the most part.
Good.
Mm-hmm.
Awesome.
Yeah. I'm able to easily make connections and form good relationships with my coworkers and my neighbors.
Okay.
Mm-hmm.
You say those are your biggest strengths.
Yes.
Okay. That's good. Do you feel that they've definitely helped you throughout life?
My strengths have?
Mm-hmm.
Yes. Mm-hmm.
Okay. Now, opposite of that question,
Mm-hmm.
what would you consider to be some of your weaknesses?
I trust people too easily. Mm-hmm.
Okay. That makes it seem like there's been a lot of past
Well,
experiences.
I
with
wouldn't know because I trust them so easily. So I don't know if I'm being tricked or not. So sometimes I do get a little anxious about that. But
Okay.
mm-hmm.
Would you describe that as your only weakness, or would you say there's something else maybe in your mind?
I think overall I feel very much like I'm an awesome person.
Okay. That's good. You have a really positive outlook on yourself,
Thanks.
which is really great.
I think I noted that as my positive strength.
Yes. What, again, this is a very general, broad question, but I want you to be as detailed as possible.
Mm-hmm.
what would you like to accomplish out of your time in therapy?
Well, I really want to just, bless you. I really want to just figure out if how can I protect myself against my own thoughts? Like, are these real? Help me to, I guess, help me through like maybe therapy like CBT to see if these thoughts that I'm having are, that are contributing probably to my stress and anxiety and my sleep and waking up and my dreams. If you can help me through it to maybe make more sense or logical sense, to see if this is something I'm just making up in my head, and help me through it, navigate through it, so that I could find peace and calmness again, be back to who I am, the essence of who I am. Is that what you do?
In a sense, right? Kind of going back to what I had said initially, the purpose of therapy, sometimes people have the perception of the therapist providing all the answers in your life to be able to get you to exactly where you want to be. In a way, you can kind of look at it that way, but the reality is that we help guide you find those own answers.
Who's we? Am I just seeing you, or
When I say we, I say therapists in general.
Oh,
right?
okay.
So our job as therapists is to be able to help guide our clients like you to be able to reach their goals and be able to do the things they want to do. And we help you find the answers, which you end up providing for yourself.
I see.
So again, there's sometimes this misinterpretation that we have answers to just give you and you can just fix yourself, when in reality it's a process that we need to go through that works, but it takes time, it takes a lot of work. Okay, I'm like, but it's not impossible. Okay, but needs to be this realistic expectation of, we're not here to just give you answers to fix your life. We're here to guide you, for you to help find your own answers, which are there. Okay, so to help you better understand yourself sometimes, because even sometimes we don't understand our own selves. Okay, that's kind of a brief summary of what I'm here to do, but I very much feel like I can definitely help you out if that's how you feel that you would contribute, or let's say contribute, but benefit from therapy. Okay. Now, with that being said, are there any additional questions that you may have regarding anything I asked, anything that you want to say?
Oh, I totally forgot. If I tell you that I think someone's going to hurt me, will you report that?
You think someone's going to hurt you?
No.
I'm not 100% sure.
That's all right. Why don't you tell me what the next steps are for me? Because I think I have to have a little break, bathroom break.
Oh, okay, understandably. Okay. So, I would say, depending on your schedule, okay, then what we would do is we'd probably want to set up a schedule for you to be coming in. I don't know if you want to do every other week. I don't know if you want to do weekly. I don't know if you want to do multiple times a week. Usually I like to start off clients every other week. Some clients like to jump in and do every week. It really is based on your comfort level. So
really anxious, so maybe like the other option you were saying, like multiple times a week. I'd like to do that.
Okay, we can definitely set that up. So basically I would just make sure to get all of the contact information that I'm going to need additionally to what you already provided. and then my office would probably reach out to you
Mhm.
and on hours, days,
Mhm.
and then we would try to best accommodate your schedule to see when you can come in. Would coming in person be better for you, or would you prefer like over video, like telehealth? What we provide both, so it would be based on your preference.
Maybe telehealth.
You wanna do telehealth?
Mm-hmm.
Okay, again, it's whatever your preference is, if that would be easier, because then
Mm-hmm.
some people do prefer that because they don't have to drive to the office,
Mhm.
and that can be, hard.
I walked here.
You walked here, wow, okay, well, you're a trooper, you walked here, hopefully you got all your steps in, but, aside from that, I think that we're on our path to slowly getting to where you wanna be.
Okay.
Right, so I hope that you coming into therapy for this
Mhm.
session, maybe made you feel a little bit more at ease in regards to what therapy is, what it can provide for you,
Mm-hmm.
okay? And again, if you have any questions,
Mm-hmm.
any concerns at all,
Mhm.
please feel free to bring it up. Again, I'm here to provide you with help,
Mhm.
okay? So don't feel too anxious. This is just the first step, but
Mhm.
we'll get to know each other better, and we'll get to where you want to be.
Okay.
Okay.
Thank you.
Right, no problem. So I wish you a good day.
Thank you.
Okay,
Mhm.
and that's it.
Okay.
Yeah,
thanks.
well, I'll call you.
Yeah, thanks.
Okay, no problem.